In this video, we're going to talk about the Tib Fib series that we have here at TCH, starting with the AP. So go ahead and lay them back. Again, if they have shorts on, perfectly fine. Just move the pants out of the way, or go ahead and lift him up a little bit. So my problem right now is that I'm not getting the central portion of the cassette in my sort of anatomy of interest that I need, and I got it too high. As normal, you know, with a small cassette, I'd be able to get them on those films, but you don't have to have that. You can modify what you're doing. If they have pants on, change them. Socks, remove them. They make artifact lines, things like that, that we can mistake for fractures or things, or it could be obscuring something that we need to see. So with that, hey buddy, hold still please. We are going to center mid-shaft of the tibia and fibula, making sure you cover joint to joint. So I've got ankle joint to knee joint. Oh, hold still, sweetie. Hold still. Hey, I know you have the wiggles, but it's okay. We're going to be done here in just a minute, okay? Good. So we have joint to joint. Make sure that that ankle, whenever you take your x-ray, is nice and straight, or that foot is pointing up. Moving that leg over so that it's not into the anatomy of interest, like we've talked about before. Hey, Mr. Wiggles. All right. So we're going to put this foot down just a she wiggled up a little bit more. Very typical movement for his age. Sometimes it is kind of hard. You're chasing kiddos around the table, that's for sure. So we're going to take the marker and put it to the side. And as you see with clothing too, it looks like we need a lot more exposure than we actually do. Do you see where the skin actually is to where the light actually is? So we can collimate a little bit more. And again, I wouldn't have him with pants on. I'd pull them up or move them. We can do that. We'll show you how that looks like. There we go.
Oh, I want to put my socks on.
We'll put them on. Good. Just relax. Just relax. Good. Just like that. And if they're wiggling like this, again, you can have parent also kind of hold them here, or you can hold them here. Take your x-ray just like you would normally do, just like that. From 0 to 5, we have an oblique tib fib view. Just relax. So all that means, put your leg down. There you go. All that means is that you're going to rotate the lower leg, and making sure that not just at here, you want to rotate also up top too. So putting a hand on their femur, rotating their whole foot internally, and you don't have to change anything about your central ray. That's all stays the same. Your marker, just relax. There we go, just like that. That would be an oblique, just relax. An oblique tib fib, just like that. Okay, so for the lateral, we're gonna turn him to roll them in just a little bit this way. And of course you would shield for that because all the x-ray is below there. So we're gonna bend the knee just like that. I know. Is that better? Okay. So roll them a little bit more. There we go. So you wanna make sure that you've got the knee on the film. Gosh dang it, now we're gonna have to turn it this way. So I had to modify my collimation here. Making sure, again, we have joint to joint. So we've got knee to ankle, foot in a 90. Whoop. Hey, wiggle worm. So we're gonna bring it just like this. And of course I wouldn't have my hand in the light, right? I wouldn't want my hand here. I'm gonna move it back just a little bit, take my x-ray just like that. That would be a lateral tib fib. If they're, he can sit up. If they're a bigger patient, like teenager, you're able to get, you can do 2 views. You can do the proximal portion in 1 view and then adjust for the ankle. Just make sure that whenever you're, oh yeah, thank you. Whenever you are doing those 2 views, that if you take the proximal portion and get the longest portion on the film itself, and then you do a small dedicated ankle, which you'll see in just a minute, then you want to make sure that the distal portion, you do the long film first, and then the smaller proximal portion. And that's because you don't want to cut off your film in the same spot. The reason being is you could miss a fracture or something because you've modified your views to fit the patient's anatomy. So making sure that you cover and crisscross your coverage to make sure that we don't miss anything, okay? And that's how we do a tib fib.